What made you sort of? You said that you're like a libertarian. That's where you put yourself, right?
I am, yeah. I'm a part of the Libertarian Party in Canada. Yeah.
Okay, so what kind of made you interested in becoming a libertarian and finding those ideas, sort of uh, feeling that they spoke to where you are now?
For sure. Well, I didn't know what it was, right? When I first heard of it a
Mhm.
few years ago, as many people in Canada didn't know. We've had the party since 1973, but many people here don't realize what it is. I'm not sure what's brought it forward in recent couple years, if it is people like Jordan Peterson or other speakers, if it's because there's been a movement in the States. I know I saw a CBC article. Now we can get into them. They're a fairly left-leaning article. They mentioned,
Mhm.
the scary alt-right libertarian movement coming to Canada, and
Okay.
there's a lot of views, right? Because there are some interesting characters in the States with regards to libertarianism. I've noticed in the States it's such a big party with there's not a great policy platform. Like I can see why they're not doing a little better. It just seems like people maybe don't have it. There's
Yeah.
not one specific policy. Whereas in Canada, we have a pretty conservative policy. It's not very different from the States or pardon me, from the Conservative Party here, in
Mhm.
respect to, say, immigration, in respect to firearm policy, fiscal policy, etc. So that kind of stuff is pretty similar, but we do have this focus on much smaller government. So the
Mhm.
belief that in a place like Canada, particularly, this demographic we're a very big country. Geographically, we could encompass multiple European countries. I mean, we're not as big as the States, or maybe
Yeah.
actually landmass,
I
maybe
think
are.
you
I can't
probably
remember the
are,
stat on that. I think we're
but
pretty close, but we don't
yeah,
have as many people, but we have very
don't have many people.
diverse, much like California to Texas. You guys are
Mhm.
completely different demographically, right?
Yeah,
So
totally,
we
totally.
we struggle because everything, even our vote in Saskatchewan or Alberta or Manitoba, BC is a bit different, but our vote is determined by Ontario and Quebec to our east. So once they're done voting, we might as well not bother, right? Because
Mhm.
the population, 13 or more million people in Ontario, only a million in Saskatchewan, right? So by the time you get the major provinces out of the way, the vote is
Mhm.
done. And generally, what we found is people tend to come from Ontario or Quebec, and they have very Eastern interests, which are very different than Western, rural, for example, agricultural interests. So
Okay.
when Stephen Harper was in power, who I hated just for the sake of hating, I guess, now I actually miss him, but he was from Calgary, so
Mhm.
he brought people liked him from here because they felt like he was standing up for the
Yeah.
West. So with libertarianism, I think there's a strong push for. I think it's a great movement in Canada. Just not a lot of people know what it is. Just the other day, I had to explain to a coworker what this is
Yeah.
because it has the word liberty in it. People assume it's liberal and they stay away from it here, and it's not.
Mhm.
So
Sure.
um,
Yeah.
I find
So
it's very deal to my values, I
yeah,
guess.
one of my questions is like,
Mhm.
libertarianism is about sort of reducing the government and
Yeah.
sort of cutting taxes, cutting spending on entitlements. So do you feel
Yes.
like you'd be in favor of like, privatizing or ending Canada's universal healthcare system? That's something you'd want to do?
Well, this is a big question, right? Because I've been someone
Yeah,
who has had to access this healthcare system for years. And it's so hard because I'd love to say, oh, it's better than the US or, oh, it's worse. But I wouldn't know unless I went through an entirely new life and tried it in the US and went through the same illness. And I could see, did I get diagnosed faster? How were my surgeries? How were the medicines? How was the treatment? The efficiency of the procedures. It's very difficult for me to say. Now, from statistics that I've read, it seems like depending on what you read, it's very hard to see who's healthier, who's having a
sure.
better success. So I have a hard time
I
with this
wouldn't go that
question.
far. I would say that our system is like horrific. There's a
That's
lot
the
of
thing.
debt.
If you're not
Yeah,
rich, I think in the
there's
States, that's why I guess
yeah.
maybe it's not depending on the stats, maybe it's depending
So
on the
like if you
demographic, right?
so like if you compare the countries where there's medical debt, the United
Hmm.
States is by itself in terms of debt
That I've
from
seen. Yeah,
yeah, that's
that
really
I've seen.
bad. Everyone isn't insured like in Canada. And so someone
Right,
like yourself, if you weren't like having a job or something, you could have fallen through the cracks and not been able
right,
to get
precisely.
healthcare.
Yes, precisely. And I was actually going to ask you about that because I mean, I can do some reading, but I know things are always changing. Obamacare has shifted everything. So, say you're someone who doesn't have like a private health plan through work and you do get sick. Like, how does that work then for that person? Do they have a safety net, a social security net? And I will get back to your question. I'm just curious
Mhm.
about even in California, because I know state to state it's different. So I'm just curious what happens to the poor right now when they
Okay,
get sick.
so it depends. Like if you're a certain level, you might have there's a something specific for people that are poor, like Medicaid.
Medicaid,
Um,
yes.
Yeah, if you don't qualify
But
for that,
awful? Is it awful?
I've never been on it, so I don't know. I think it's better than nothing, basically.
Is it kind of just for the very poor, and then there's a middle gap where you don't have almost any money, but you're too rich for Medicare? Is it kind or Medicaid? Is that kind of one of those sorts of
Sort of.
situations?
Yeah. I mean, basically, like at a certain level, you're just uninsured, and if you get
Mhm.
sick or something, you go to work sick, or you don't, you don't have health. You become unhealthy, and it sort of perpetuates
Right,
itself. That's a huge problem with our
right,
system. Huge problem because
right.
there's a
Yeah,
lot of
for
people who
sure.
are uninsured. I mean, it was just like I read the statistic. There's some ridiculous amount of people who work in fast food who go to work when they're sick, right? These are people
Just so they
who,
don't have to go to the doctor. Yeah.
well, yeah, they either can't afford it or they don't have insurance, or
Right,
and
yeah,
also they don't get time off. They don't get paid time off
right.
at work.
Yeah, no,
So
I've heard that you guys don't have the same, like, regulatory stance on vacation days and whatnot, nationally
no,
that other countries do, which
yeah,
is unfortunate because that's something
it's really
I
bad.
don't approve of. I'm not an put it this way, to start off, I'm not an anarcho-capitalist, so we'll start there.
Okay,
I
all
certainly
right,
don't
we
believe.
cut that out. All right,
Yeah, we got that out of the way. I don't subscribe to quite that extent of the ideology, and it's partly because of the experiences that I've had, and because I've been in poverty,
yeah,
and I do believe there has to be a social safety net of some kind. Now, our Canadian Libertarian Party is a little bit maybe more compassionate in that sense. I don't think anyone in the Libertarian Party, not that I've spoke with yet, I'm sure there's some, but most people don't generally want to just screw everyone, cut everything, privatize everything. Certainly, that's not what I want. Now, the thing about the Libertarian Party, especially here, it's very grassroots. So when I run, I'm not going to be running to win. I'm running to build the party, right? So
okay,
I know that already. It takes the pressure off. It's all volunteer.
hmm
Canadians don't. There's no funding for the party in Canada because we don't have enough members or enough seats. So until that happens, you do it because you love it. You do it because you care. So,
yeah, yeah,
um, so yeah. So for me, I wouldn't say that I would ever push for that agenda. Now, if I'm in a policy platform and they're going to push for that, am I going to get stuck trying to, value wise, moral wise? I guess we'll have to see. Tommy
So
Douglas
you
being
don't
from
know where you would
province.
fall on that, like
No,
if
I think I fall on I fall on the side of Tommy Douglas for the most part. Tommy Douglas was our kind of the curator of our modern healthcare. He's from Saskatchewan. He was an incredible politician, incredible human being. Um, I think Canadians, I don't think that even if you tried, I don't think you could get rid of our healthcare system. Like, I don't
no, I
think you
don't
could
know.
ship that. I mean, that would be an overhaul that would probably just decimate this country just based on the fact
Yeah,
that you just can't take someone out of a socialized medical care system and just be like, hey, you have to pay for it now and there's no coverage. I mean, I can't imagine. And I mean, that would never happen. The people would revolt. It would be a
they revolt.
disaster. So
Yeah,
I think as much as we complain about healthcare here, which is valid because we do have major
the wait times are
issues
kind of
in
bad,
certain
right?
parts.
Like the wait
Yes, yeah,
times.
there's always yeah, wait times are bad, depending where you are. My city is
Mhm.
great. The city I just came from, awful. You might be in the
Yeah,
ER for 8 hours for something quite serious. Doctor shortages, bed shortages, hospital closures, lack of technology for, pushing for research. But then again, when I lived in Vancouver, so this is also interesting. Many people don't know. Every province, of course, has different healthcare. BC being the only province that actually will charge you a premium. So it's semi-privatized kind of.
mhm,
So, or I guess it would be like publicly subsidized.
mhm.
So if I'm really poor, I don't have to pay a subsidy or a premium. I think there's a limit of how much you make a year, maybe 12,000 or something.
Sure,
So
sure.
low income people get free. Anything above that, I think it was $60 per person or 300 for family. So that's per month. So that's something that you pay. Now, I found when I was in BC, the healthcare was 20 times better. So I'm a big
Mm,
believer in sort of semi-privatized healthcare.
mhm.
I know I've heard the arguments of it's not fair and it pushes people behind, and if you have money, you win, but it also opens up spaces for the poor. So if everything's shuffling forward, I don't see how it can be a bad thing. We've seen private MRI clinics succeed very well here, private X-ray clinics, CT scans, that kind of thing. They've all done quite well, and they haven't hurt the less fortunate. They've only opened up spots for those people. So Alberta has a somewhat different healthcare system, like a two-tiered, and then BC is public, but they have a subsidy. So, and then in Saskatchewan, it's free, but you get what you get because not every doctor wants to come to somewhere that's minus 45 in the winter,
Yeah,
right?
yeah.
So it can be tricky with doctor shortages here for sure.